During the 2019 JIR Winter School, Professor Tim Niehues did a presentation on the challenges of classification. He illustrated these challenges through multiple cases, and you will discover in this video the first case.
We start with this first child. This has been presented in this workshop already, but I do it again just to practice how we're gonna do the asking of the case. So what is your diagnosis? This is a child 2 months old, continuous fever as an infant, has this rash, has it in changing locations, has very marked eosinophilia, and has raised inflammatory markers. So what do you think this is?
Now, which of these 5 diagnoses do you think this case is linked to?
Okay, for the majority is for CAPS, and that's very rewarding. After having been here for 3 days and working on autoinflammatory disease, it's rewarding on one hand, but on the other hand, if you look at if I may continue, this actually was a case with CAPS, but we only found out late. This is like 15 years ago we had this child, we treated this child, and only after giving him anakinra, at that time very prudently, because we didn't have any genetic testing and so on, it was very new, but he responded immediately, and now he's now 14 or 15 years old, goes to school, doesn't have any impairment, so it really helped. And the mutation we found had been published before, so it is really a CAPS. But if you classify, if you use the criteria, it doesn't classify as a CAPS. So because it has only raised inflammatory markers and an urticaria-like rash, it shows you the discussion we just had. What Thilo was saying, colchicine response and anti-IL-1 response might be an important help in diagnosing a case. But in most clinical scenarios in real life, you wouldn't have given IL-1, so you don't have that criteria at hand. So you cannot make a decision.
He could have musculoskeletal symptoms because he was irritable.
Yeah, you may count this, but this arthralgia, myalgia in an infant is impossible to. It's almost impossible to say. Yeah.
If you like this video and would like to find other ones like this and other content about pediatric rheumatology, please go on the JIR cohort website, where you will find a lot of training materials related to pediatric rheumatology and autoinflammatory diseases. Thank you to the Foundation Rhumatisme Enfants Suisse and to the Pediatric Rheumatology European Society Press for their technical and financial support to create this video.